Thank you. Yes.
Can you tell us a little bit about what President Obama said to you in terms of helping you get to this moment?
I've had 4 separate meetings with the President. The last one, of course, being on his trip to Cleveland. And he explained to me what he felt was at stake. And I shared with the President my concern about the legislation. Much of it was territory that we had gone over before in previous discussions. And so I can't say there was anything really new, but the moment of decision and what he felt was at stake for our nation and for the hopes to make any kind of change down the road gave me more to think about. And I went into that last meeting with him with a desire to listen to what he had to say. Because I think in Washington, the big mistake that we get into here is that we become so intractable, we just forget to talk to each other. And when the President of the United States wants to have a conversation with you, you take that seriously. And you listen to what he has to say. I mean, he obviously hasn't changed my mind about where I think health ought to go. But this is about the bill. Yes. Sabrina Eaton, plain dealer.
Thank you. Congressman, did you get anything like Louisiana practice or anything like that?
That's not what our discussion was about. And Sabrina, I understand that the things that I want to see in this bill are unlikely to be in this bill. I have to make a decision on the bill as it is, not the bill as I would like to see it.
What about the President's sales job view made this different than when the administration wanted to vote for the budget and for financial reg reform and for the climate bill? Because you voted against all those with some...
Well, I appreciate the fact that you mentioned this, because when I, understanding, I got an invitation to go on Air Force One, given my previous record in not supporting the administration on many things, I thought that proper attire would include a parachute. But I would say that, notwithstanding the fact that the President and I have had disagreements on a whole range of policy issues, I felt it was important to listen to what he had to say. And I will tell you something. The meeting previous to the one that I had with the President on Monday was a meeting at the White House. And many of you covered. There were myself and 8 members of Congress who had supported the bill. I was there as the person who had opposed it. And I left that meeting without any thought that, maybe I was going to change my position. I wasn't thinking about that. But I also left it with a real sense of compassion for our President and what he's going through in this. We can't forget that, we're human beings trying to do a job and do what we feel is best. And that's something that I would say that regardless of what anyone's position is on this, we have to be compassionate towards those who are called upon to make decisions for this nation. It's not an easy burden that he has taken up. And while I have some disagreements with him still about this bill, I've made a decision.
Mr. Kucinich,
yes, and I'll get to you.
Did the President make any sort of promise to pursue the public option at a future time as part of your discussions?
What he committed to was to continue to work with me on the broad concerns that I have. He didn't make any specific commitment, because I understand that at this point he really is in a position where what he said is that basically this is the bill, and there's not what happens down the road is going to be a matter of continual effort. And I will take the President up on his offer to continue to work with him down the road on health care reform, because this is certainly not going to be the end of it once the bill passes. As I mentioned in my prepared remarks, and as I mentioned to the President, there are other areas of concern that I have with respect to health care. You know, when you look at the impact that diet has, and nutrition, you have to consider that Americans make choices every day that adversely affect their health, that run up the cost of the system. And we don't really have the kind of education about that we need. The First Lady is obviously working in that area. But I know from my own experience, and I'm sharing this with you. Look, I actually, through my adult life and also my childhood, I had Crohn's. And it was quite debilitating. And until I actually got involved with my own health, instead of having someone else tell me what they're going to do to make me healthy, I had to get involved. I had to change my diet. I used alternative medicine, including Chinese medicine, to try to create a shift in my own health. And what I found, for me, the results were miraculous. Now, everyone's different in that regard, and people have to have freedom to pursue that. And I, of course, advocate that. And I talked to the President about the role of diet, nutrition, and some of the other things that we can do down the road. And I'm going to stay active on this issue. This is one of the core issues that I've worked on my entire life. Yes.
Congressman, do you have any indication that your vote for yes will open the floodgates for other progressives who are still hesitant for supporting the bill?
Well, if I can vote for this bill, there's not many people who shouldn't be able to support it.
Are you going to have discussions?
Yeah. Pause for laughter. Yes.
When you were not for the bill last time around, in an MSNBC interview, you described not supporting the bill as building on sand. There's no structure here, that you're building on a foundation of privatization on the health care system.
Look, every criticism that I made, and you could go to whatever search engine you use and pull up dozens of them easily. I maintain that the bill is flawed. I got it. It's not the bill I want. And I've been pretty vocal about it. So I have to ask myself, am I going to just rest on my philosophical position here, which I remain committed to, and look at the American people and say, no, I'm not going to do this. No, there's a moment of decision you have to make. Again, not at the, looking at the bill as you want it, but as it is. And again, the criticisms I've made, you can recall them, and I will not retract them. Yes.
Can you clarify what the single most persuasive argument was that persuaded you to change your mind? And also, it sounded like you're suggesting that part of your decision involved a concern that if Obama failed in this effort, it might impact his ability to enact the future legislation.
Well, there's a couple things. I'm in my district all the time, and when I'm not in Washington, Elizabeth and I are back in the district, and I'm going out and talking to people, and there's a lot of confusion about this bill. People who are against it are against it for reasons that may not be entirely valid. People who are for it are expecting more than's really there. But when I think of how people are looking for something, they're looking for some hope that maybe something can be changed. Yeah, I kept hearing it over and over, people saying, well, something's better than nothing. That's what I kept hearing from my constituents. And you can argue with that if you want, but that's like a common folk wisdom that I kept hearing. And and at the same time, a real desire for our president to succeed. We have to look at what's going on in this country. The effort that one of the things that has bothered me is the attempt to try to legitimize his presidency. That hurts the nation when that happens. He was elected, and we even though, as this gentleman pointed out, I've had some serious differences of opinion with the administration. This is a defining moment for whether or not we'll have any opportunity to move off square one on the issue of health care. And so even though I don't like the bill, I've made a decision to support it in the hopes that we can move towards a more comprehensive approach once this legislation is done. And to go back to your question, I think that it's not just about health care. It's about creating jobs, about helping to keep people in their homes, about enabling the President and the administration and Congress working together to have the ability to create the kind of social and economic agenda that lifts up America.